Good afternoon, Mr. Doe. Hi, Mrs. Doe. Hey, Sarah. My name is Naomi. I'm going to be one of your nurses caring for you today, and this is my colleague, Gerline.
Hello.
We just wanted to check in, see how you're doing and how you're feeling, and talk about any questions or concerns you might have concerning your care, especially regarding the changes that you've been experiencing lately.
Yes, and if at any time you feel overwhelmed or emotional, please let us know because we want this to be a safe and comfortable conversation.
Thank you. I've just been really tired today. The pain's been really bad the past few nights, and I've been thinking a bit what the doctor said and my options moving forward.
Thank you so much for sharing that, Mr. Doe. You know, you've been dealing with a lot physically and emotionally, so it's completely understandable to have questions about your care. We're here to help you understand what your options are and, support you with whatever you're feeling. Before we continue with this conversation, do you feel comfortable to share right now, or do you need a moment? In this scene, I assess Mr. Doe's readiness to learn by checking his pain, emotions, and ability to focus. I also assess the family's emotional state and beliefs to guide my teaching.
No, I can talk. I just want to understand what choices I have so I don't have to keep suffering like this.
No, of course. It takes a lot of strength to share that with us today, Mr. Doe. And we'll go slowly and keep things simple and clear. And Mrs. Doe and Sarah, I just want to check in with the both of you because, this decision doesn't only affect Mr. Doe, but it affects the whole family as well. How are you guys dealing with everything?
Honestly, I'm overwhelmed. I don't like talking about this. It feels wrong. I don't want him to give up. I don't want him to be thinking about things that go against our beliefs.
Thank you for being honest, Ms. Doe. Your feelings and beliefs are incredibly important. And many families struggle with these complicated decisions because they're emotional and they're tied to your cultural and spiritual values. This moment highlights cultural and spiritual beliefs. I validated Mrs. Doe's concerns and maintained neutrality to ensure respectful, cultural, and competent communication. We want to respect them fully. And it's okay to feel conflicted. This is not obviously an easy situation for anyone, especially Mr. Doe in this case.
I'm trying to support both my parents, but it's really hard. I want him to feel less pain, and I don't want him to have any more pain actually in general. But I understand why my mom feels this way and the way she does, and I just want to get through this together.
That's completely understandable. You're doing your best to support both of them. And that can feel, that's a huge burden to bear. So what's important for all of you is to feel heard and respected and included in this overall decision.
And we want you to know that you're not alone in this. There's many support options available, such as medical, emotional, spiritual, and we just want you to know that we are here for you and we are here to guide you through this time.
And Mr. Doe, can you tell me about what you already know about the options available to you, including the ones mentioned by your doctor?
Here, I identified knowledge gaps and planned learning goals. The main objective is for the family to understand MAID and the available options so they can make an informed decision. There are things that we can do to keep me comfortable, and there's that other option, assisted dying. I don't know anything, but I don't want to suffer anymore. I want to understand what that means.
Thank you for sharing that. What you're expressing is very valid. People in your situation often want relief and clarity and control. And, to help you understand your options better, I can explain them step by step in order to help you make an informed decision.
Implementation is shown when the nurse uses simple language, checks for understanding, and offers written materials and spiritual support.
And please know, Mr. Doe, no one is expecting you to make a decision today.
I don't want him to choose something he doesn't really need. I don't want him to sin.
I hear how deeply this is affecting you, Mrs. Doe, and Sarah, I'm sure this is affecting you as well. Your faith is a part of who you are, and we want to honor that. One option is for us to involve a chaplain or a spiritual leader who can support you through this. What you're feeling is normal, and you don't have to manage it alone. We have a lot of resources and support provided in the hospital.
I think that might actually help.
We've created a calm, supportive environment by validating emotions and giving space to talk openly. This helps build trust and encourages effective learning during difficult conversations.
We also have written information about end-of-life decisions, which include MAID, and everything in these are written out in simpler terms. It focuses on guidelines supporting this teaching, including CNO standards, ethical practices, and the Ministry of Health made resources that ensure safe and informed communication. So we want you to take it home, read over it. If you have any questions or concerns, you can bring it back to us.
And the most important thing is that you understand every option available to you. You know, we want you guys to feel supported.
This scene shows cognitive learning through clear information, effective learning by addressing emotions and strategies like plain language and family involvement to support understanding.
And we're here to guide all of you, not to rush any of you. And Mr. Doe, we want to help you maintain dignity and comfort. And we want your family to feel supported and included every step of the way.
Thank you. I really appreciate that.
Evaluate learning, the nurse would ask the family to explain the information back in their own words, clarify questions, and document emotions, understanding, and next steps.
Of course, we'll continue this whenever you feel ready, but we'll take things one step at a time.